Emily Lubring. I'm the Federal Programs Unit Director for the Division of DD. And we have Leslie Bradley, like Kat mentioned, she's also with the Federal Programs Unit. And Jazine Slockley and Barbara Brent are from the NASD's Technical Assistant Team, and they're joining us today to help us moderate and help with the conversation for feedback today. Just to start off, we'll provide just an overview of our objectives for today. We want to start by understanding the waiver services for our HCBS waivers, determining eligibility, reviewing the waivers for the specifically for this presentation, the Missouri Children's Developmental Disability or MOCDD waiver, and the Partnership for Hope, our Partnership for Hope waiver. And then lastly, we're going to go over the renewal process, understanding that process, and then gathering input from stakeholders. And our focus today is actually that gathering input from our stakeholders, getting our feedback from providers, individuals, and families. For the Missouri Medicaid HCBS waivers, we have 4 waivers in the state of Missouri, and the waivers help provide services to participants who would otherwise be in an institution, a nursing home, or a hospital to receive long-term care in the community. Medicaid funds the HCBS dollars in Missouri, and that consists of state general revenue dollars and federal dollars for the waiver services. To be eligible for a Division of Developmental Disabilities DD waiver, you need to be eligible for the Missouri Division of Developmental Disabilities, be a MoHealthNet Medicaid eligible as determined by Missouri Family Support Divisions. It also includes evaluation of the need for immediate care facility for individuals with intellectual disability, so LOC or level of care, with meeting the federal definition of developmental disabilities with 3 substantial functional limitations, have an active habilitation need, and reasonable indication that the individual has needs that could be met with ICF services unless provided in a home and community-based services waiver. The ICF or the ID, the LOC is determined initially and then reevaluated at least annually are specified by the approved waiver. Now we'll go into just a quick overview of the waivers that we have in Missouri for the DD population. We have 4 of them, as I mentioned earlier: the comprehensive waiver, the MOCDD waiver that was started in 1995, the community support waiver in 2003, and then our newest one was the Partnership for Hope waiver, which was started in 2010. Today, we're going to focus on the MOCDD waiver and the Partnership for Hope waiver, which are the 2 that are next up to be renewed. And starting with the MOCDD waiver, we're going to review that information about that. And I'm going to pass it over to Leslie to provide us that overview.
Thanks, Emily.
Just a second, get it passed down to you.
Okay. As Emily stated, in 1995, Missouri implemented its MOCDD HCBS waiver. The targeted population is children with developmental disabilities, and the Division of DD currently has the capacity to serve 366 participants in this waiver. The last MOCDD waiver renewal application was approved by the Centers for Medicare and Medicaid Services, or CMS, effective July 1st, 2018. And as Emily said, the next renewal will be in July of 2023. Just some quick important facts about the MOCDD waiver. As I said earlier, this waiver serves 366 children and does not have an annual cost cap. The child must be determined not eligible for any MoHealthNet program. If the child has a MoHealthNet spin down or a premium, the family must explain why this is a financial hardship and cannot be met. The child must be living at home with their family and under the age of 18 to be supported in the MOCDD waiver. And the MOCDD waiver is not for children who only need Mo Health Net services or state plan services, such as private duty nursing. Private duty nursing is not a service through the MOCDD waiver. Services available in the MOCDD waiver include 15 services designed to meet the needs and flexibility of the participants supported in this waiver, and they include applied behavior analysis, assistive technology, community networking, community specialist, which does allow for self-direction, crisis intervention, rehabilitation, environmental accessibility adaptations, home vehicle mods, in-home respite, individual directed goods and services, individualized skill development, out-of-home respite, personal assistance, which also allows for self-direction, specialized medical equipment and supplies or adaptive equipment, support broker, and transportation. And to give you details on the Partnership for Hope waiver, I'm going to pass it back to Emily.
Thanks, Leslie. In 2010, Missouri implemented its Partnership for Hope HCBS waiver. The Partnership for Hope waiver is county-based waiver that is a result of a partnership between the Missouri Association of County Developmental Disabilities Services and the Division of Developmental Disabilities and the Mo Health Net Division. This waiver includes 25 services, has an annual cap of $12,362 per individual. Number currently served is about 2,200, and we have up to 3,415 slots or participants that can be served in a fiscal year. And this Partnership for Hope waiver is also renewing in 2023. This slide gives you a view of the counties that are participating in the Partnership for Hope waiver. Currently partnering, we do have several that aren't, but mostly the state is partnering with us on this waiver. Some facts about the Partnership for Hope waiver. The Partnership for Hope waiver has an individual cost cap of $12,362 per person. The county and the division will each pay half of the state match for the Partnership for Hope participants. The partnership waiver has a couple services that are only provided under the partnership waiver, that being family peer support, dental, and temporary residential services. And the participant must be residing in the participating county and meet crisis or priority criteria. The services provided under the Partnership for Hope waiver include applied behavior analysis, assistive technology, benefits planning, career planning, community networking and community specialists, also available self-directed, community transition, day hab, dental, environmental accessibility adaptations and vehicle modifications, family peer support, individual directed goods and services, individualized skill development, job development, occupational therapy, personal assistant, physical therapy, pre-voc, professional assessment and monitoring by registered nurses, licensed practical nurses, registered dietitians, specialized medical equipment and supplies, speech therapy, support broker, supported employment, temporary residential service, and transportation. The home and community-based 1915C waiver applications renew every 5 years. And the last Partnership for Hope and MOCDD waiver applications were approved by Centers for the Medicare and Medicaid Services, CMS, effective July of 2018, and are set to renew in July of 2023. The actual renewal waiver process starts several years in advance, which is why we're starting this process now, talking about the renewals. and it includes several steps in the process. The first step is stakeholder input. Then we move on, we have evidence reports for performance measures that have to be submitted to CMS. We have public comment, both informal and formal in the process. MoHealthNet reviews the change, and then the submission of our waiver application to CMS. And from there, we have a question and answer process back and forth with CMS to iron out any questions they may have, make sure we're following CMS guidelines, and then eventually, lastly, CMS waiver approval. So today, that first step, as I mentioned, was the stakeholder input. And that's the part that we're going to focus on today in this webinar. We wanted to get together and we scheduled webinars with the stakeholders to allow stakeholders to provide us feedback on these waivers. We're requesting, we want stakeholders to think about how the services provided in the waiver work for our individuals and how services can be improved to better serve MOCDD and partnership participants. So we have Janine and Barb with us today from the National Association of State Directory of Developmental Disabilities Services, or NASDs, as part of this portion of the webinar to help us assist us with moderating the webinar. We will ask attendees to use the chat function to enter feedback and comments on our service definitions and the delivery of services. We realize that the topic of rates is a great impact to our providers and individuals. And although this is a very important topic, it is part of a larger conversation about the division's requirements to standardize rates per CMS requirements. So I'm saying that just as we may not be able to address feedback or comments on the rates, provider rates at this time. We want to focus our webinar to gather feedback, improving the services for our participants. So Barb and Janine, if you guys want to share a little bit of your background, and I'll check the chat for any questions that we have or comments and feedback.
You're muted, Janine.
There we go. How's that? Better? Okay.
Yeah.
Good afternoon, everyone. Barb, I said I would start, and please jump in here. My name is Janine Zalaki with the National Association of State Directors of Developmental Disabilities Services, and I am the Director of Technical Assistance and Special Projects. I am with my colleague, Barb Brent, who also works for NASDs, who is the Director of State Policy, and together we have been working with Missouri for a number of years. You might, if you had joined one of the previous webinars that they did on their, I want to say, comprehensive waiver, you would have saw our faces or heard from us, because we were partnering with them to ensure that all of their questions were answered on federal issues. But what I want to say here today before we delve into the feedback is the public notice process and notice to stakeholders is really, really super important to ensure that the state really hears everyone's perspective about the changes that they're making. Missouri has done that for a very long time. This public input process has to be sufficient, which is why they're having this, to really reach all of the people that are receiving services, all of the stakeholders who are involved, or others who could potentially be eligible for services. A public input session such as this is required by federal regulation for a new waiver or a renewal of waivers, which we're talking about today with the two waivers that we discussed. You also need to discuss any substantive changes, and those are things like Emily mentioned, changes in rate, changes in provider qualifications, eliminating or reducing services. Those are just some examples. And this public input process, stakeholder input process, has to happen at least 30 days prior to the state submitting the waiver renewal. So as you can see, as was discussed, that these waivers are up in 2023, the state is really doing its due diligence to get out in front of this and hear from you all ahead of the game, which is terrific. So I want to commend our Missouri partners for that. So Barb and I are here, and Barb, do you want to add anything else? We would love to hear any questions or comments you have about this process, the renewal, that we can help you with today and support the state. Barb?
I just want to also applaud Missouri for the amount of time and effort that is put into public comment, and we understand that there's surveys that have been put out, and that Missouri is ahead of the game in terms of how much outreach there's been. There's a provider committee. There's a lot of outreach. In some of the waivers, people may not always get everything that they want. Because CMS may or may not approve, or there may not be the funding by the legislature to do every single thing that one would hope. But through this process, the state works very hard to get those things that are the most important and that will really make a difference. And there's no one, whether it's CMS, the state, or anybody else, that isn't trying to get the best support possible to the people that you all serve and care so much about. So with that, let's go.
Okay,
So
so
I see, oh, sorry. Oh, go ahead.
You go ahead.
Okay, I was going to see, I know that there was a question on the cap and that you clarified that, but there is also a question about the Partnership for Hope waiver and remote support. So, you know, and I don't know if the team wants to bring up the slide that you had, the waiver services for the Partnership for Hope, but I do not see a remote support definition in that, but I want to make sure that I'm clarifying that right with our Missouri colleagues. And I also wanted to ask the person who wrote the question, you know, ever since the COVID-19 pandemic and the state's ability to use an Appendix K, which is just another Medicaid authority for emergencies, you all, or some of you, may have experienced some supports and services being delivered and being referred to as remote delivery of support or virtual delivery of support. So I want to clarify, is that what you're talking about? Or are you talking about an actual remote services definition that I think is part of your comprehensive waiver? Do I have that right, Leslie?
And what it says in there is an actual remote support.
Yes. So that is actually a service under the assistive technology service in the Partnership for Hope waiver. So we do offer remote supports or remote monitoring through that service.
Great.
I saw another comment about from Anne. She says the process for accessing funding through the MOCDD waiver is extremely cumbersome and presents a hardship for families.
So Anne, I would also like to know maybe some specifics. Can you give us some more specifics about exactly what is cumbersome and what specifically what you're saying presents a hardship for the families? And while we're waiting for Anne to respond, I'm going to go ahead and just let everyone know, like I said, The MOCDD waiver serves 366 participants, so it is a very unique waiver. It's small. As I said, the individual has to be determined not eligible for any MoHealthNet program unless they have a spend down or a premium that cannot be met with expenses or by the family. It presents a financial hardship to the family. So there is a lot of steps that we ensure to make sure that individual does meet the waiver qualifications. The Division of DD a couple of years ago even implemented a MOCDD waiver screening request to kind of help screen children and go through, try to streamline that process. So I just was wanting a few more specifics that I could hopefully address for Anne.
And while Anne's thinking about that, Leslie, I was, looking at the in facts about the MOCDD waiver, which you just, highlighted for us again. And the waiver is the payer of last resort. So it may be that interplay between your MoHealthNet program and services, of which are an entitlement to folks who qualify and could use them. So it may be that you're experiencing that piece of this, but I just wanted to toss that out there if that was one of the impacts.
Or third-party liability, even for children that have private insurance through their families. And it's a good point overall, not knowing the specifics of what's cumbersome, whether something is truly what's cumbersome to be able to access the waiver and get in versus something that would actually change the waiver. So it's a process that could be more helpful versus what's a waiver change. And that's always good to hear about too.
Yes, I completely agree, Barb and Janine. So very good points. And also with the MOCDD waiver, as I kind of alluded to in that MOCDD waiver slide, is that the child must have a waiver need, an ongoing, monthly habilitative waiver need, and not only need for state plan or MoHealthNet services, which is a benefit of the MOCDD waiver, but they must have an ongoing waiver need as well.
I'm going to go ahead and Maria mentioned in 2020 there was much support for adding music therapy as a waiver service. At that time, the request was denied, but the Division of DD stated that they would consider adding music therapy in future waivers, and she would like to request that music therapy be considered as a waiver service. So we will take that as a request and put it on our list of things to talk with Division.
It looks like there's also a question about folks having a challenge with getting their service coordinators, case managers to understand the community specialist service and how that can be implemented under self-direction or be provided by an agency. Is there anything you want to comment on that, Leslie?
And it indicates that it may be a barrier for service coordinators to offer it because they aren't exactly sure how the process works, if I'm reading the comment correctly.
That is it doesn't give a lot of specifics. I'm not exactly sure what, it sounds like maybe a general understanding of the service, and that may be something we need to consult with the self-directed supports director regarding and Georgia, if you could give us some more specifics, I'm not sure, or what might be helpful. Is it the Oh, go ahead, Emily.
I was going to say that same thing. If you could give us some specifics of maybe how you have wanted to use the community specialist, or are you looking to our support coordinators to give you examples of how to use it? I think if you have examples of some that you have asked about, that would be good to, for us to understand and know.
Yeah, we can take those back to the subject matter experts to get answers, you know, more self-directed.
Okay. Yeah. Thank you very much, Georgia.
Yeah. And just for a little clarity, if you wouldn't mind too, Emily and Leslie, you know, your state has your service offerings that are in the waiver, and we're looking at the Partnership for Hope waiver services. And community specialist looks like it's a part of your those who are self-directing, right, have the opportunity. So it is a service that's offered. So I just want to be, you know, clear here on they're not quick to offer it. You know, you can still bring it up and talk to them about it. You know, there would have been an assessment. You would have talked about your needs and the outcomes that a person wants to achieve with them. So my point is, don't be afraid either to bring it up with your case managers, because I know if they're not quite sure about a specific question, they have wonderful supervisors and wonderful help here at the state to answer any of those detailed questions. So I just wanted to make sure that you're not opposed to bringing it up yourself as well.
I also saw an email or a question from Gus in the chat. If and when any changes are made, I'm guessing to the waiver or to the waiver services, when will the changes be effective? Will they be retroactive to the July 1st start date? So on our normal cycle of getting approval for our waivers, our normal process is to get approval before going into the effective date, which would be July 1st, 2023. This past year, you saw where we got approval of our waivers in September, and and it retroactively for the comp and CSW was effective July 1, whereas Partnership for Hope was the amendments cannot be retroactive. The amendments we did for Partnership for Hope and MOCDD. It depends on the changes we make. Some things can be done retroactively and some changes can't be. It depends on the change. You can't start a new service retroactively.
Mm-hmm.
So it really kind of
Emily,
depends on the changes.
Excellent. That is an excellent point, Emily. I think I highlighted as well some of those substantive changes that you were alluding to. You had said services, you know, we mentioned those. We mentioned things like changes in rate, service specifications, the elimination or the changes in the amount scope. So I just wanted to piggyback on Emily's excellent point there. I'm not seeing any more in the general chat. I don't know if Emily and Leslie, you are receiving any additional questions on your presenter chat.
I haven't received anything.
We can certainly just wait a few minutes and see if people have some thoughts as they've gone through the other chats and are thinking through it.
Yet another one. Will individualized directed goods and services require contracts? That is a new service. This recently was implemented with our comp and CSW renewals, and then our amendments to partnership and MOCDD. I don't know that I can answer. I have a thought in my mind. I think I know the answer, but I think I think the best thing would be to take that question back to our SDS lead, who would be able to answer the actual process for that, if contracts would be required. So we can get in contact with our lead, SDS lead, and then also follow up with Georgia on that question. Oh, and then she followed up with, will they be built through Acumen? And that's, yeah, so Georgia, I kind of have the same question, or I kind of think I know the answer to that, but we better check with our lead on it.
And just, just to add in here, that oftentimes goods and services do pass through your fiscal intermediary, et cetera. But as Emily noted, they'll follow up with the state process. But, goods and services that are purchased also have to be clearly linked to an assessed need of the participant and identified in the service plan. They really focus around equipment, services, or supplies not otherwise provided through the waiver program or the state plan, but they address a need in the service plan. They also improve and maintain the person's opportunity for full membership in the community, and really have to meet a couple of requirements. The good and service would decrease the need for other Medicaid services and or promote inclusion in the community. They or increase the participants' safety in their home environment. And the person does not have the funds to purchase the item or service, that it's not available to them. The item or service that they are requesting is not available to them through another source. So we just wanted to kind of pop in some of the expectations around that as well.
It's pretty clear in the technical guidance, and then we hear more about the importance of community inclusion and the health and safety and community inclusion, really having those opportunities. So they've been reinforced very much, and rightfully so as of late.
I don't know if you're seeing anything else, Emily or Leslie. Let me see here.
I think we maybe got them all.
Okay, since we're not seeing any new questions coming into the chat, more comments. I think we'll go ahead and wrap up today. And I want to thank everybody for attending, providing feedback through our chat sessions. I want to thank Leslie and Janine and Bar for being on here with us with this. And also, let me move forward in the slides. Should have, let's see here. There is some resources in about the Partnership and Hope and MOCDD's eligibility and waivers, fact sheets. And then if you think of something else that you didn't have a chance to express to us, comment or feedback that you wanted to provide us on the waiver services for the MOCDD's and Partnership Hope, you can send an email to the ddmail@dmh.mo.gov and include, put in there for Emily or Leslie about the waiver renewal process, stakeholder input, and it'll get to us and we'll include it in our feedback that we've received for the renewal process. So I want to thank everybody and
Emily,
yeah,
it looks like
yeah.
you have another question.
Oh, another question. Okay. So the question is, if an existing service has a definition change that is retroactively approved, does it go into effect the start of the waiver approval date? I guess it still goes back to what that change really is. I don't think without in a specific example, trying to think of one that would be retroactively versus not, but I still think it would go back to what that change is. Could it be applied retrospectively or not? I hope that answers. If you have a specific question, you're more than welcome to email us and we can, if there's one that you're referencing that you're thinking about, just reach out to us through the email and we can help answer that.
He is saying a raise in the service cap.
Raise in a service cap. So recently we did have a raise in a service cap of a couple of our services. And that was not one that was retroactive because we were operating under a temporary extension of our current waiver year, the 5th year waiver year, until the new changes had been approved by CMS. Kat, do you have any more questions that you've come directly to you or anybody else that may come directly to one individual?
No, we're clear.
Okay. Okay. Well, I appreciate everybody's time today. Again, email us if you have more questions and thank you everybody for joining. Bye.